Hello, my name is Philip Sappi. I am a nurse here at Valley City Regional Hospital, and I am tasked with creating and implementing a disaster protocol for our hospital. In this presentation, I will go over disaster events that can occur within our community and show how our hospital can respond to these situations. We will review how interdisciplinary collaboration is crucial for mitigating harm following a disaster event. Additionally, we will analyze government policies that affect community recovery following a disaster. To better understand the disaster plan, we will provide an overview of disaster situations that can affect healthcare organizations worldwide. Disasters can occur at any time and cause significant harm to the community. According to the World Health Organization, in the last 10 years, there have been, quote, more than 2.6 billion people that have been affected by natural phenomena such as earthquakes, tsunamis, landslides, cyclones, heat waves, floods, or severe cold weather. Unquote, World Health Organization 2023. These situations place a significant burden on the community and hospital systems. Preparation is necessary to mitigate the impact of the disaster and increase the survivability of disaster victims. A disruption in communication systems worsens a hospital's response during a disaster emergency. According to the article, Hospitals as Disaster Victims, Lessons Not Learned, Eric Melnchuk finds that during disasters, hospitals must have, quote, communication systems that function independent of the availability of electricity, unquote. Melnchuk 2022. The failure of communication devices disrupts communication within the hospital. Moreover, the hospital will be unable to communicate to responders outside of the hospital without a communication fail-safe. This can lead to miscommunications that place disaster victims at increased risk for delayed or inadequate treatment. Medical facilities can quickly become overwhelmed by the increased number of victims from a natural disaster. The needs of these patients will vary significantly, requiring precise triaging and prioritization of resources. Resources such as water, electricity, and HVAC systems can become unavailable during a disaster. According to Melnchuk, there have been instances of hospitals losing backup generators and water pressure during a disaster, leading to the unavailability of electrical, medical equipment, and water. Melnchuk 2022. Triaging and limited resources. The hospital will have to effectively distribute the limited resources among the disaster victims. This will require appropriate triaging of each patient that arrives at the emergency department. The limited resources will be focused on the victims that are high priority with a likely survival chance. Vila Health train disaster. 2 years ago, our community experienced a disaster situation when an oil tanker train derailed, causing a fire that resulted in numerous injuries and 6 casualties. The hospital's staffing and resources were overwhelmed by the hundreds of victims from the accident. The incident underscores the importance of developing a disaster recovery plan that lessens the burden on members of our community and first responders. The hospital's response. The hospital was ill-prepared for the sudden influx of victims. During this time, the hospital's disaster plan was over 10 years old and lacked the necessary guidelines to effectively deal with the disaster. Our Associate Director of Hospital Operations pointed out that the communication between our hospital team and first responders was inadequate. The hospital lacked a cohesive plan for such an extensive catastrophe. Additionally, the emergency responders had difficulties with internal communication within the police department and external communication involving the hospital. There are many social, cultural, and economic barriers that affect community recovery after a disaster. Community members that are socially vulnerable are at risk for a poor response to disaster. Examples of socially vulnerable community members include elderly, children, ethnic minorities, and those with poor social support. According to the article, A Social Vulnerability Index for Disaster Management, author Barry Flanagan finds that after a disaster, the, quote, socially vulnerable are more likely to be adversely affected, i.e., they are less likely to recover and more likely to die, unquote, Flanagan 2011. To mitigate this, Flanagan suggests increasing the social services available to this population following the disaster events. Flanagan, 2011. Cultural factors can strengthen or weaken the community's response to a disaster. Understanding the cultural makeup of the community is necessary for predicting the disaster response of the community. According to the article Disaster Preparedness and Cultural Factors, a comparative study in Romania and Malta, author Sandra Appleby-Arnold found that, quote, ethnic minorities, women, and people of lower socioeconomic status are shown to have higher levels of disaster risk perception than the rest of the population, unquote, Appleby-Arnold 2021. These community members would likely to have a better response to disaster situations within our community. Economic barriers. There are several economic barriers that negatively affect the community in a disaster event. The local economy is suffering, and people are losing jobs within our community. Even our hospital is considering reducing our nursing staff due to budget concerns. According to the Agency of Toxic Substances and Disease Registry, quote, high poverty, low percentage of vehicle access, or crowded households may affect the community's ability to prevent human suffering and financial loss in the event of a disaster, unquote, Agency for Toxic and Substances and Disease Registry, 2022. A disaster event that leads to the loss of homes will increase our homeless population, which will require shelters that can handle a large amount of displaced community members. Additionally, the hospital will have difficulty finding placement for patients that are without housing and unable to care for themselves. These issues will require extensive social services to help financially support these people following the disaster. To improve the disaster plan, the organization must utilize the Map It, Mobilize, Assess, Plan, Implement, Track framework. The first step of this plan is to mobilize, or partner with groups in the community that will respond to emergency. These members of the community will require effective collaboration to mitigate the harm caused by a disaster. The groups involved will comprise of the police, firefighters, hospital staff, paramedics, and ambulance drivers. An effective partnership between these entities will ensure exceptional rescue, evacuation, and treatment operation. Each group of responders will have an established leader, which will facilitate communication between the entities. Elderly and disabled residents. The next step is to assess the needs of community members based on demographic data to develop a recovery plan. There are many social, physical, economic, and cultural barriers that affect safety and recovery efforts during a disaster. Valley City currently has a population of 8,295 people. Of these residents, 204 are elderly with comorbidities, and 147 are physically disabled or use American Sign Language. These populations are at increased risk for long-term health complications and death during a disaster. Additionally, our population of undocumented immigrants may not be able to fully comprehend English. Community finances and resources. The community is experiencing an economic decline, affecting employment at the police department and hospital. This means that human resources will be limited after a disaster event, which will decrease the availability of responders. Triage classification. An effective disaster plan requires appropriate triaging based on the specific disaster. According to staff members working during the train derailment, there was incorrect triaging that resulted in minor injuries being treated before more urgent cases. This is inappropriate considering that the derailment resulted in nearly 200 people being hospitalized. To improve triaging during a large-scale disaster, the hospital will assess patients based on the care flight triage method. According to Jafar Bazar in the article, Triage Systems in Mass Casualties, Incidents, and Disasters, a review study with a worldwide approach, the criteria for triage priority includes, quote, walking ability, obeying the commands, palpable radial pulses, and airway respiration. Bazar, 2019. This is a quick and effective triaging method and color codes victims based on priority. The priority for treatment is listed from lowest to greatest priority. Non-salvageable, black, delayed green, emergency, yellow, and urgent, red. Communication. Proper communication is required for effective disaster planning. Communication between emergency responders and hospital staff must be clear, precise, and time-effective. This will reduce miscommunications that can cause potential harm to disaster victims. Additionally, there must be effective communication between emergency responders and the public. This will establish order and give direction to citizens affected by the disaster. The planning phase features objectives that must be met to have a successful disaster recovery plan. This phase includes the immediate steps that must be taken during a disaster to allocate services, assign roles to hospital members, establish communication, and allocate resources. Additionally, the plan will include contact tracing in the recovery phase of the disaster plan. The hospital needs to have clear objectives to increase health equity through equal access to medical and social services during and after a disaster event. Role assignment. Responders must understand their individual role within the disaster response team. Members must follow the chain of command within their field. Within our organization, a senior emergency department nurse will be appointed to triage patients that arrive at the hospital. These patients will be assigned to nurses based on the nurse's experience level. Physicians will be directed to the highest priority patients based on the care flight triage method. Additionally, experienced staff members will be appointed to communicate with incoming emergency vehicles for patient pre-assessments. Establishing communication. Communication is one of the most vital aspects of the disaster response. The hospital must be able to relay information to internal and external sources during the disaster response. For internal communication, our hospital will utilize radio communication if the loss of electricity is a concern. This will allow for communication within the hospital and between outside sources. Additionally, the hospital must communicate with the community during a disaster event. According to the Federal Emergency Management Agency, Effective communication to the public includes information on the, quote, specific hazards, location, time frames, and magnitude, unquote. Federal Emergency Management Agency, 2014. Relaying this information to the public will provide community members with an improved understanding of the disaster event in the community. It will provide the public with information on evacuation and sheltering during the acute disaster phase. Human resource allocation. The hospital needs to be aware of the human resources available during a disaster. This can be done by listing current staff availability and staffing contacts. In the article Developing Hospital Emergency and Disaster Management Index using TOP-SIS method, Mohammed Mojtahidi finds that understanding the human resource availability during a disaster will improve the, quote, mobilization and recruitment of personnel during an emergency or disaster, unquote. Mojtahidi, 2021. The mobilization of additional human resources during a disaster will decrease the burden of first responders during the acute disaster phase. When implementing our disaster recovery plan, there is a need for education, training, and resilience building from our hospital staff. Both hospital staff and community members will benefit from a cohesive training program. Disaster response, education, and training is necessary for every staff member at our hospital. Through scheduled training events, staff members will become more confident in their ability to respond to disasters like the train incident that affected our community. The need for disaster training for all hospital staff members is evident in peer-reviewed literature. In the article, Disaster Preparedness Training Needs of Healthcare Workers at the U.S. Department of Veterans Affairs, Michelle Bullitt finds that the most necessary training needs for staff members includes, quote, specific roles, incident command structure, their hospital's disaster plan, large-scale exercises, and disaster drills, unquote. Bullitt, 2022. By completing a yearly review of our disaster plan, staff members will gain an improved understanding of their role within our organization. Additionally, disaster simulations will allow staff members to gain different perspectives on how teamwork and patient care changes during disaster events. The public benefits from disaster response training as well. Community members can access life-saving training through organizations such as the Red Cross. These training programs include cardiopulmonary resuscitation and first aid training, which can save lives when a trained medical professional is not available. Healthy People 2020 and 2030. Our hospital's recovery plan is designed to satisfy the Healthy People 2020 and 2030 goals and objectives. One of the primary objectives of Healthy People 2020 goals was to, quote, achieve health equity, eliminate disparities, and improve health of all groups, unquote. U.S. Department of Health and Services, 2023. Our disaster plan focuses on those living with disability and chronic disease within our community. Additionally, the plan includes contact tracing for vulnerable members of our community. Our hospital is striving to reach the future goals set by the U.S. Department of Health and Human Services. A significant goal of Healthy People 2030 is to, quote, improve emergency preparedness and response by building community resilience. U.S. Department of Health and Human Services, 2023. Our hospital's plan encourages community members to reach out to organizations such as the American Red Cross for emergency preparation. By doing so, the community can learn life-saving skills that may be necessary if a disaster were to occur in our town. Health and government policies work to provide structure after disaster events. One of the main governmental agencies focused on disaster response is the Federal Emergency Management Agency. The primary framework for disaster response outlined by the Federal Emergency Management Agency is the National Disaster Recovery Framework. This framework utilizes a, quote, flexible structure that enables disaster recovery managers to operate in a unified and collaborative manner, unquote, Federal Emergency Management Agency 2023. Within this framework are 6 recovery support functions, RSFs, that work to restore the health and well-being of community members following a disaster. These include community planning and capacity building, economic recovery, health and human services, housing, infrastructure systems, and natural and cultural resources. Federal Emergency Management Agency 2023. These supportive measures aim to stabilize the affected community and promote financial and emotional recovery. FEMA draws assistance from many organizations during this time, such as the American Red Cross and the Department of Health and Human Services, to aid in recovery. The Stafford Relief and Emergency Assistance Act was established in 1988 to provide states and local communities with organized federal support. This act provides a framework for determining the level of aid necessary for a community during the disaster phase and recovery phase. The act requires state and local governments to have a disaster plan ready for the ease of collaboration with federal responders. Enhancing interprofessional collaboration. Interprofessional collaboration is a fundamental component of patient care. In disaster responses, the need for well-ordered interprofessional collaboration is a priority for mitigating harm caused by the disaster. Following the Hurricane Katrina disaster, healthcare systems realized the need for improved disaster response training. Hospitals have strived to create evidence-based training programs to respond to disaster scenarios. In the article, Collaboration between Academia and Practice, Interprofessional Crises Leadership and Disaster Management, Cheryl Hoying describes a disaster response training program that utilizes recommendations established by the Joint Commission and the American Organization of Nurse Executives Crisis Management Task Force. This training program begins with a needs assessment that identifies, quote, the required knowledge, skills, and abilities needed by leaders to respond to disasters and emergent events, unquote, Hoying 2017. This gives an analysis of the leader's current ability to respond to disaster situations. Additionally, the program encourages leadership training to foster the development of interprofessional teamwork. This type of training helps to identify the communication barriers that hinder performance during a disaster situation. This concludes the end of my presentation. Thank you for watching.